Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. A very interesting question in regards to vitamin D. There's so much conversation about vitamin K, magnesium, and vitamin D, and someone wanted to know that they read it was important to take vitamin K and magnesium when you're taking vitamin D, and they want to know if this is true or not. I want you to know personally, I use D-Emulsion Forte from Biotics Research Corporation on its own. I know there's a lot of companies out there that make a lot of different suggestions about a lot of different nutrients. I'm not telling you to or not to use vitamin K or magnesium, but I use a liquid vitamin D applied directly to my tongue every day, and we have many of our practice members that do the same. We get wonderful results supporting their vitamin D metabolism. You may have other options. That's just what I do. Can you please provide me with a list of foods and supplements that aid in preventing blood clots? Well, I have had individuals in my life that have been on a low-fat diet, and they've received or had deep vein thrombosis. We've never promoted the low-fat diet. Oil is good. You may look at your blood test and look at your LDL. LDL, if it's elevated, is a body signal to us that you in fact do need oil. But omega-6 fats can cause inflammation. We talk about this in Dr. Bob's Trans Fat Survival Guide. I would encourage you to possibly have an essential fatty acid blood spot test done. If your omega-6 fats are elevated, and if your arachidonic acid levels are elevated, you want to eliminate dairy, minimize or eliminate the omega-6 fats, and maybe focus on omega-3 fats. But if you take too much omega-3 fats, you can get an excess of that also. And if you take too much flax oil, you could actually have a deficiency of vitamin B6. And we can determine your vitamin B6 levels by looking at your liver enzymes on an OptiChem. So an OptiChem is a test that we do in our practice and we do for our worldwide clients. That's really a good idea at least one time a year. So somebody was watching one of my videos somewhere, and I was talking about tinnitus. Some people call it tinnitus. And they also wanted to know about Meniere's disease, Meniere's syndrome. We have treated Meniere's, and it's amazing. Through spinal adjustments and eliminating or minimizing sugar, we've seen Meniere's, which is really dizziness, vertigo that comes from an inner ear challenge, and I have a footnote on the question to show where I got some exact answer from it. It's going to cause spinning, where tinnitus is ringing in the ears, which we've seen improve with vitamin A emulsion, and also by helping improve one's thyroid gland. So it's a combination of lots of possibilities. Last question. On your Facebook Live, you mentioned golfing and estrogen on the golf course. The question was, what about walking on grass? So grass itself, as long as it's not been sprayed, it's all about the spraying. Herbicides and pesticides sprayed anywhere. You know, I really believe sometimes that the epidemic that we're having with pets and cancer, as silly as it might sound, is walking on grass. They spray and it goes right into these animals' hoofs, right through their paws. And it goes right into their body. So, you know, if you have an animal that has cancer, and I'm not telling you not to take your dog on a walk, but you would probably be better off to go to a natural park that you know has not been sprayed. So when you take your dogs on walks in your neighborhood, and people have ChemLawn and all these other green stuff going on, those dogs are being exposed to very toxic chemicals. So it's great questions, actually quite pondering questions. And you know, we have people come to see us from all over the world. I would encourage you, if you have an issue that nobody else has been able to help, spend a week with us. We have a couple right now from Africa that are spending an entire month with us. We talk to people from all over the world. People come to see us from all over the United States. You can come into Cleveland, Ohio. You could take a Uber or a Lyft or a taxi over to our office, spend a couple days. We have wonderful shopping around here, and let us help you get better. We're just seeing so many people are being forced into having surgeries today. I'm not telling you not to have surgery, they might not need if they take the right steps in advance. Thanks for listening. I'm Dr. Bob DeMaria.